What does it take to restore hope? Sometimes it's simply one person reaching out a hand to help another in need. Hi everybody, I'm Steve Dunn, news anchor for KATU in Portland, Oregon. Since 1979, volunteers with Northwest medical teams have reached out and restored the hope of countless people in hopeless situations. I felt privileged to watch these dedicated volunteers in action when I joined them in Honduras and northern Iraq. Over the years, more than 600 teams have participated in missions of mercy around the globe. Responding to some of the worst disasters to hit our world this century, these volunteers have risked their own lives, caring for people on the brink of death. But not all our volunteers travel to other countries to help people in need. Sometimes the needs are just as great here in our own backyard. Since 1989, Northwest Medical Teams has provided basic dental and medical care for low-income families in the Pacific Northwest. And that's a story of hope for a little boy named Oscar. Not many people think of their first trip to the dentist as a life-changing event, but that is the case for a little boy named Oscar. At Oscar's young age, many of his teeth were already abscessed. The pain he suffered made it difficult to concentrate or even eat in his kindergarten class.
His teeth were so black that I didn't know if they were fillings or I didn't know what they were. They were his teeth. They were so rotten, and it just clicked because every day at lunch he couldn't eat. I would watch him just having an awkward time chewing food. He didn't know which side to chew it on. The food would literally fall out of his mouth.
Oscar's dilemma is not uncommon in the Pacific Northwest. Each year, thousands of children and adults from Oregon and Washington suffer from tooth decay and gum disease. Over 1 million people in the Northwest live below federal poverty levels. Most have no health insurance and cannot afford the high cost of a dental visit. But one day, a mobile healthcare clinic from Northwest Medical Teams came to Oscar's school.
He had multiple dental abscesses in his mouth, so when he came to us, we diagnosed his problems.
We're going to make models of your teeth.
Model?
Yeah.
What does it mean, model?
It'll be a perfect little impression of your tooth, and you pull it up, it'll be like a model, and you can look at your teeth from the outside.
We were able to remove the non-salvageable abscess teeth. In subsequent visits, we were able to restore and treat his other teeth that we could save. And he came in a different boy the second time we saw him.
He's never sick anymore. Before he had the dental work, he constantly had a green, runny nose. Since
1989, more than 20,000 patients in the Pacific Northwest have received dental care on board a mobile healthcare clinic. Now Northwest Medical Teams has 4 vans on the road with a goal to bring mobile health care to 12,000 needy patients in 20 Northwest counties. Each mobile clinic is a full-service, self-contained motorhome customized and operated as a mobile dental and medical clinic. Each unit is fully equipped with up-to-date technology to care for each patient's critical needs.
The first Friday of every month is our clinic day. The children anticipate the dentist being here. The teachers are more aware now of what's going on in their students' lives beyond just homework. There's no way we could have ever done this. It would have been a monumental task to try to advocate a private dentist to come in and all of the other liability issues and things like that. And this was already in place.
How many times a day are you going to brush your teeth? Excellent.
This was literally a godsend to these children, and I'm really grateful for that.
Each year, hundreds of volunteers like Oscar's dentist sacrifice their time, skills, and resources to touch low-income families and the homeless in the Pacific Northwest. Through the reaching hands of Northwest Medical Teams, we're restoring hope one person at a time. Thank you for reaching out your hands to join our team.